Hi, everyone. Thank you so much for joining us for another edition of Adam Interviews, where we are talking with folks in our community who are doing noteworthy things. Our guest today is someone who has been really saving lives. He is the divisional head of dermatology over in the Rochester Regional Healthcare System. And Gian Vinelli, we are so grateful. Dr. Vinelli, we're so grateful that you joined us.
Thanks a lot for having me, Adam.
So one of the reasons, I guess the reason we thought to do this today is the Skin Cancer Foundation sent out a note to various media outlets across the country, and we were one of them, and they basically said there's new notes out, new statistics out from the American Cancer Society, and they were pretty startling, and maybe for me, maybe you're like, well, this is normal, but the one that caught my eye is the increase of a certain type of skin cancer. So they said the past decade, 2016 to 2026, the number of new invasive melanoma cases diagnosed annually increased by 46.6%. Am I reading that right? I mean, I'm a layman here, but your thoughts on that?
Yeah, no, I mean, it's unfortunately, skin cancer is typically something that develops many years actually after the sun damage. So there's a significant latency period. Even though, most people I think these days are a little more familiar with sunscreen and sun protection, they may not have been 20, 30 years ago when, they first started being outside a lot more. And so that time it takes to develop skin cancer is always going to be a lag from when you actually start to realize the public to protect themselves. So unfortunate, but not surprising among the medical field.
So what you're saying is that what folks were doing in the 90s or the thousands is really what we're seeing now.
Exactly. And I think some of that correlation that we're seeing with melanoma, which is very associated with indoor tanning, is probably having an effect here. Especially, I'm in my 40s, but growing up, a lot of my, friends, teenagers would go to tanning salons and do that all throughout, their 20s. And now we're seeing kind of the effects of that, I believe. On top of that, there's still people sunscreen is not the easiest thing sometimes to apply, and people rarely apply it enough or reapply, which really ends up getting to skin cancer later in life.
I remember this was years and years ago. There was an ad saying, just as we develop better ways to treat skin cancer, people develop better ways to get it. And there was a picture of someone on a beach with the big tinfoil, bringing the more sun into their face. Your thoughts on that? I'm guessing that tanning might be considered something in that category.
Yeah, 100%. So, I remember growing up in Florida, people would have the sun reflectors in their front windshield to help keep their cars cooler, but they would also double as ways to sit on the beach and reflect the rays right at you. And so those are the kind of things that unfortunately lead to skin cancer later in life.
And it's interesting too. So there's so much I don't know about this. There's different types of melanoma or skin cancer, some that sits right on the top surface and that's not necessarily as dangerous.
Yeah, so melanoma in general is pretty scary.
Okay.
So, ultimately, well, thankfully, melanoma rates of death have been dropping every year for the last several years, between 2 to 3%. Ultimately, it is still something that people do succumb to. But you're right, there are different types of melanoma. The more superficial spreading type you're describing tends to be a little bit less aggressive, especially if it's caught earlier in what we call the in situ stage. But then there are more, aggressive forms like nodular melanoma, which can be, unfortunately, very minimal. This looks like a little dark spot on your arm, your leg, your back, and can spread to the other parts of your body and become, unfortunately, life-threatening pretty quickly.
I thought something that was interesting. Again, these statistics are we read them in the newsroom. We just couldn't get over some of the surprises, I suppose. One of them was that of the invasive cases, 65,400 will be men, 46,600 will be women. This is the estimated for next year. I guess because I thought tanning, I know men go tanning, of course, but for some reason, I thought it would be swapped there.
Yeah, the long-standing history is, even though women, would typically have more revealing, going to the beach or things like that, men tend to have their shirts off more regularly. So in terms of exposure, men tend to develop skin cancer a lot more on their back, whereas women typically more on their legs. So that being said, I think people are getting better at realizing, think of the rash guards and things like that. Those are a great way to try to protect yourself, but still, can go into the water and be outside and be gardening or um, still get the enjoyment of being outside, but hopefully protecting yourself a little bit better.
Yeah, it says it's estimated that the number of new melanoma cases diagnosed in 2026 will increase by 10.6%. That's
It's going to, I think, close to over 200,000 now. So I mean, and that's what's impressive. So not just melanoma, but then we call the non-melanoma skin cancers. There's actually over 5 million of those diagnosed every year, which is actually, the skin cancer in general is more common than all other skin cancers cancers combined.
Combined. I knew it was more than all, but I didn't realize combined.
And that's always the struggle is people go to their primary care doctor pretty often. People go to the dentist pretty often. But rarely do people actually come into the dermatologist for kind of an annual check. And especially in the Rochester area where we are kind of outside boating, golfing, even in the winter, people often forget just because it's cloudy. Now, see a lot of clouds in Rochester, the UV radiation which causes skin cancers goes through those clouds at about 80%. And so if you're skiing up at a higher altitude, you're still at risk of getting those sunburns, and that can lead to skin cancer. So really all year round, you're at risk.
It's interesting because then you hear the advice that we need vitamin D too. And, you don't want to stop that.
Yes, which that's a great point. Not to ingest, but obviously your body does generate vitamin D through the use of sunlight. Now, that being said, the amount of sunlight you need is trivial in compared to what it takes. If you're outside for 5-10 minutes, you should be in good shape. That being said, if you're outside for 3-4 hours without protection, that's when you get really concerned about developing skin cancers.
Yeah. So selfishly, I tried to use sunblock throughout my life. There have been cases I've probably been really sunburned 10 times in my life. Is that something that someone should be concerned about, or is it case by case where it could have an impact?
Yeah. Ultimately, I applaud you if you've only had 10 sunburns. Growing up in Florida, I think I've had hundreds. But
I was born and raised in Rochester.
Yeah. So you did better than me, but unfortunately, if in your case, if you've had more than 5 sunburns, your risk of melanoma who hasn't is actually double. So you are still at risk. And even though you're a pretty young guy, I would still highly recommend, if you've had those kind of sunburns, to make sure you're seeing a dermatologist. If you give us a call, I think I can find a dermatologist for you.
Oh yeah, no, I appreciate that. No, I have one, and and it's I've been going to one for years. Even when in my 20s I started. I don't know how I got on that kick, but when we moved back, it's annual, if not biannual, and I feel so reassured because you do see, especially my parents' generation. You see it on their forehead, and the good thing is, and that gets to another question I had is, when you talk about the diagnosis, could that also be just because more people are getting checked, or there's a better way to diagnose? Sometimes we talk about autism, people say, oh, there's more kids with autism. And then the retort from those in the community say, not necessarily. There's also, we're just screening more people and we're better at detecting it. Is that the same case here?
100%. So it's actually, I guess it's twofold. So one, you're totally correct. We have gotten better at catching it. The amount of training, the number of dermatologists, we're still, definitely lacking in our total number of dermatologists in the United States. But we've definitely gotten better at training other healthcare professionals to kind of diagnose it. But also, there is a fact that when especially comes to the baby boomer generation, prior to their generation, the prevalence and the likelihood you're going to go to a warm climate for vacation was much less. And so really, with the following generations after baby boomers, this idea of travel outside the United States, traveling to the Bahamas, going on cruises, has rapidly increased. And it's really felt among the dermatology community that's really has contributed to why so many, unfortunately, of our patients in the 60 and older crowd have developed 1, 2, 3 skin cancers, because in the 80s and 90s and on, that they were getting excessive sun exposure.
Wow, that's interesting. Yeah, and by the way, I just want to verify, not that anyone would doubt you, but the statistic you brought up at the top of this interview, within the Skin Cancer Foundation's letter that they sent out. They said melanoma mortality has decreased over the past decade by about 2% per year for women, 3% for men. So I find that fascinating that while the diagnoses have increased, the mortality has decreased.
Yeah, so when it comes to really the scary types of melanoma, we are very fortunate that we're in, kind of a new age of treatments. In the last 10 years, especially, some of the more systemic, medications, people think of like chemotherapy agents for melanoma have exploded in terms of the options we have. Obviously, the goal is we hopefully never have to need one of those. But those medications are incredibly effective, whereas 10, 20 years ago, we really didn't have anything. Jimmy Carter was one of the big names that were first on one of these medications, and he had a horrible case of melanoma, and he really should have passed, and he did not, because he was able to get these treatments well before usually the general public, and when it was in the trial stage, and it saved his life, and it's now since these medications have saved countless others. So, yes, while we are, I think, totally right, we are picking it up more. We're also just getting more of it because of sun tanning, and still a delayed tail on the exposure, but we're also, less people are dying from it because of the new technologies and the new patients.
So I want to talk about the new technologies, dive into that, and I have a couple other questions about prevention, but I want to take a short break, and when we come back, we're going to get into those topics. So Dr. Vinelli, hang on for me for 1 minute, and we will be right back. All right, we are back with Dr. Gian Vinelli. He is with RRH, the division head of dermatology, and really just incredible numbers out from the Skin Cancer Foundation, talking about the increase of melanoma cases in the country, just staggering numbers, an increase of 10.6% expected in the coming year, and over the past decade, increased by 46.6%. And yet, the mortality rate has declined. So that speaks to, I suppose, before we get into the technology, I suppose that also speaks to the early detection, because I've always, like most cancers, I suppose, but skin cancer in particular, the earlier you detect it, perhaps, it could be an outpatient procedure, or maybe even less, depending on when and what type of cancer is found, if I'm not mistaken.
No, 100% correct. So ultimately, that's where as we were talking earlier before, getting in to see a dermatologist on a regular basis is a great idea. So the majority of actually skin cancers are not the melanoma type, which is fortunate because those can be much more aggressive. But the most common type is something called basal cell carcinoma, and there's actually about 3 to 4 million of those diagnosed every year. And thankfully, these are not life-threatening skin cancers, but they are ones that, if we don't remove, can kind of eat away at the skin and become painful and bleed and get into muscles and nerves. So it's not something you would ever want to keep. But we can easily, remove them in an outpatient setting, often if we catch it early enough, without even needing any sort of surgery at all. There's different topical treatments we can do, and creams and things. And for the second most common cancer, which is called squamous cell carcinoma, that is even sometimes easier to catch at an earlier stage. Because it really develops just as like a little red crusty spot that can easily be frozen with a little bit of liquid nitrogen in our office. It takes 2 seconds to freeze it, and it actually can stop something from developing that could be potentially life-threatening. Because unfortunately, squamous cell carcinoma, there's about 1 million of these diagnosed every year, and those do account for actually a significant number of mortalities each year, actually more than melanoma, but because of just the sheer number more that are diagnosed.
Interesting. I don't mean to get too personal or gross here, but my dermatologist saw a mole one time, did not show signs of anything, but just where it was. And they said, you know what, let's get rid of it. And I mean, within minutes, it was gone. Are we seeing more of that as well?
Yeah, definitely. So we're kind of inundated with patients because so many people have still, especially in the 40 to 60-year-old range, didn't grow up with good sun protection habits, and so they are starting to develop much more, and especially now as the millennials become the largest population generation. And I think they're a little bit starting to get out and understand that they need to go and see a dermatologist. So yeah, having a biopsy done in that age group especially is very typical, and it's actually really important at the same time, not just to see a dermatologist, but if you have a lot of these moles and things, it's not a bad idea about once a month, give or take. Get out of the shower, give yourself a little bit of a once over. It
Hmm.
just to you don't need to look at every single thing, but you have a general understanding of like, oh, I've always had this mole here, and if something does pop up that's new, it's exceedingly helpful, especially in this day and age with cell phones and things. Just take a photo. Wait a few weeks, wait a month, take the same photo again. And if it is very different, and that's a good time to definitely call a dermatology office and make sure you can get in, um, because that could be something concerning. Chances are it's not. We do
Yeah.
develop these lumps and bumps as we get older, but nevertheless, it's a much more helpful to the dermatologist if you have an understanding of like, oh, how long has that been there? Has it changed size, shape, color? Is it bleed? Anything like that? Very useful for us so that maybe we don't have to do a biopsy, but maybe we know immediately we do need to take a little piece of skin to send to the lab to make sure it's not something dangerous.
Do instances of skin cancer, do they normally hurt? Do they irritate? Because sometimes if you can't see them, at least you might feel them.
No, that's a great question. So the short answer is yes and no, which is obviously not the great answer. Some skin cancers, like melanoma, can be totally asymptomatic. Literally, it doesn't bother you at all. Or by the time it does bother you, it's usually in a much more aggressive form. On average, though, the majority of the ones, especially of those basal cell and squamous cell, which again, those are about the most common, about 4 to 5 million of those diagnosed every year combined. Those typically start off. Sometimes people think they look like a pimple. I think of my patients, majority of them say, "Oh, I thought it was a pimple." It just didn't go away, and then
Hmm.
it would heal up, and then it would bleed, and it would hurt, and then it would come back. Really after like 4 to 6 weeks, if you think you have some sort of pimple on your body, and it still hasn't healed up, going into 1 to 2 months later, that's the time to definitely reach out and have a professional take a look, because ultimately it's probably nothing. But
Hmm.
things like that should heal, that haven't, that are bothersome, really should get checked out.
You mentioned the millennials. Is this message getting through to the younger generations? Are they better than we were in the 80s?
It does seem like there's been a shift to some extent. Now, again, obviously, because these things take 20, 30 years to develop, it's really hard to see right now. But I do think, the general education out to the public is much better than, prior generations. Patients often come in and about ready to do a procedure on them for skin cancer. And I was like, oh, I knew I shouldn't have, been outside so much. I love just being out on the beach. I love being out in the water. And there's no fault there. 40 years ago, when most of my patients who I'm treating now for skin cancer were getting sunburns, we really didn't know. Yes, kind of knew about sunscreen, but now I think most generations, most of the younger generations, millennials and younger, really understand that the sun can be dangerous and you really have to protect yourself.
You had
I also
mentioned,
Go ahead.
sorry, go ahead, please. No, please.
No,
Go ahead.
I kind of same idea to some extent as smoking.
Oh, yeah.
50, 60 years ago, really, heck, 80 years ago, they used to say smoking was good for you. So, I think that's as skin cancer from sun damage and smoking and lung cancer, I think have kind of gone hand in hand. I think most people these days know smoking is not good for you. I think that is come out the same thing. Too much sun is bad for you.
Yeah, and that should knock it down a little bit. I've read about how they're using AI for radiology, looking at scans and helping with breast cancer and things like that. Is that being applied to, you said, click a photo. Are there any programs out there that can help doctors notice any signs or trends within a dot or, like you said, kind of almost a pustule?
Yeah, no, I mean, exactly. And I'm familiar with those in radiology as well. They kind of help, pre-screen them. So there are actually technologies that are out there now for dermatologists, where if you take a photo of something, it can kind of pop up a differential based on using, AI. That being said, so far it's still kind of in its infancy. That's one of the uh, somewhat difficult things about dermatology is that there's about 6,000 total diagnoses in dermatology, and they present in about 100 different ways. And so really distinguishing those can be very difficult. So I think, in the future, there's definitely going to be a space for that, especially for non-dermatology providers. I think it's going to be a valuable resource to let them know, like, is this something that needs to see dermatologists immediately, or is this something that, we can kind of watch? Because unfortunately, there are not enough dermatologists out there. But right now, the technology is still being kind of developed. There's definitely some apps that have been out, but unfortunately, when you actually look at the studies on them, they're still not great enough that they can give you an accurate diagnosis at all time. But they do help, kind of form what we call a differential diagnosis. So like it could be this, or this,
Hmm.
and then kind of go from there.
Yeah, but I guess a note of caution to folks that don't lean too heavily on that type of technology at this point.
Yes, especially if a healthcare professional hasn't really reviewed that, I would be very wary.
Yeah. You mentioned, so going back to treatments, you said Jimmy Carter actually took medicine. Are you talking about like a pill for something like melanoma? Is that where we're at right now, or a shot? What is that?
Yeah, so there's we call systemic chemotherapy agents. This, without getting too fancy, the ones that were used were called PD-1 inhibitors. So it's a more uh, a medication that kind of helps with in terms of the rapid growth of tumors.
Hmm.
And we call it checkpoint inhibitor. But ultimately, it is something that is much more specific to melanoma. It is used in other cancers as well, but something that before we really didn't have something that was so effective. Um, there are, of course, some side effects that come with them, but compared to in his case, he had what we call metastatic melanoma. So the melanoma had spread from the skin to other parts of his body and to his organs, and that's usually where it becomes fatal. So he was what we call stage 4 melanoma, which is the worst type. And this, medication was able to, save his life. And then, I mean, that was over a decade before he died. So,
Wow. That's impressive. I mean, obviously, I'm guessing surgery is still used. I remember 30 years ago, I had a relative who had melanoma and part of her calf had to be removed. Is
yeah.
that still something today that happens?
So we've come a long ways in terms of the surgical treatment. To take a step back, I am what's called a Mohs micrographic surgeon. So I am a cutaneous oncology surgeon. Um, so pretty much what I do all day is I remove skin cancer surgically. The way we do it, which is through the Mohs technique, is we take very small margin around the skin cancer and actually take that out while the patient is still in the office.
Hmm.
And then we go and actually have a lab right down the hall here, and we check all of the edges and the bottom to make sure the cancer is removed. And if it is, then we'll bring the patient back in and we're able to stitch them up. But if it's not, we will see right where on their skin the cancer is present. And then I can take a tiny little bit more, and then we check it again. And by doing that, we're taking as little normal skin out, and we're able to make the scar and the surgery as less complicated as possible. I'd say in the olden days, 20, 30 years ago, this was not a technique that was used very often or available. I mean, even in Rochester, 30 years ago, there was only one person from Buffalo to Syracuse ever doing this. Now we have about a half a dozen or more. But still, in terms of the sheer volume of skin cancers, fortunately it's not utilized as much. But yeah, 30, 40 years ago, they used to take 2-3 centimeter holes,
Yeah.
which now we can do things like this. So it
Boy.
has improved, not just the medication side, but also the surgical side. We've gotten much better. And yeah, these things are all done in outpatient settings. And, before I was training and I was a kid, these things all would have been done in the OR under general anesthesia, which, if you don't have to go under, general anesthesia, it's always better. It's pretty safe, but it's not without its risks, especially in our older population who are typically affected by these skin cancers. So yeah, being able to do this in an outpatient clinic, local anesthetic, takes a few hours max. Same day, you can drive in, drive out. It's a vast improvement over what we previously used to do.
It's interesting. You think about the dermatologists of 1985 and what they think now, and then you flash forward what this is going to look like in 40 years.
Yeah, I know that's a joke. Some of my friends and I who do surgeries are like, they're probably going to look back at us and be like, what were these guys doing carving at people's skin? Uh, not to be too much of a dork here, but I don't know if you ever saw the Star Trek movie where Dr. Bones is in like a hospital. He goes back in time, and there's a woman who unfortunately is suffering some horrible cancer, and he gets his little tricorder and he does, and then the cancer's gone, and she's walking
Yeah.
away. And he's like, they're barbarians, And I
Yeah.
think 40 years from now, they probably will look back on us as like, I can't believe, Dr. Vinelli cut skin cancer for people's faces. Like, what a barbarian.
Yeah, but I'll tell you what, they'll still appreciate the good work that you did. And we had to use a backup Zoom for this interview, and I just got the notification that we got to go because this is not the upgraded version. So I could talk about this all day.
No, I appreciate you having me.
Yeah, no, this has been great. Keep up the good work. And folks, if there's one lesson to take away, go get a dermatologist if you don't have one and get your annual checkup. So that's huge. Dr. Vinelli, thank you so much for your time. And thanks to your whole team out there. So of course, Dr. Gian Vinelli over at RRH, head of dermatology there, the division head. So thank you so much for watching. Tell your family and friends about the Rochester First app. These types of interviews can save lives, and we're so glad that you listened in. And if you can, so easy to download the Rochester First app to smart TVs. Take care.
Get the Rochester First streaming app today for everything you love from News 8 On Demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.